Hello, I'm Dr. An from Korea University. I'd like to present a case of seminal vesiculoscopy performed for patients with refractory hematospermia. Hematospermia, although often self-limiting, can become clinically significant when persistent or recurrent. And this case involved a 37 years old male with 6 months history of recurrent hematospermia. He had no fertility issues, but reported occasional pain during the ejaculation. His initial semen analysis revealed normal count and motility, but reduced volume. Transrectal ultrasound showed a right seminal vesicle dilatation and a midline prostatic cyst with internal heterogeneous echogenicity. A cytal view revealed cystic dilatation with anechoic and hypoechoic contents. MRI shows T2 low signal intensity in right medial inferior seminal vesicle that suspect hemorrhage or stone. A preoperative ureteroscopy shows a prominent perimeteum. Although obstruction was suspected, no distinct intraluminal lesion was identified. Based on imaging findings and endoscopic evaluation, we planned seminal vesiculoscopy using a transutrical approach. This technique involved creating a fenestration through the prosthetic utricle, especially targeting the junction area between the utricle and the seminal vesicle. Here is a surgical video. We initiate the procedure using a pediatric stethoscope. A metal guide wire was carefully advanced through the perimeteum to assess the prosthetic utricle. Upon entering the utricle, a yellowish stone was clearly visualized within the cavity. We performed a lithotripsy using a hollow laser to fragment the stone. The stone fragments were subsequently retrieved using a foreign body forceps and a stone basket. After stone removal, we to evaluate the potential pathology within the seminal vesicle. Uh, we advanced the guide wire through the utricle to junction between the utricle and seminal vesicle. A transutrical fenestration was created at this junction to gain access. Inside the seminal vesicle, a typical honeycomb pattern of the mucosal fold was observed. Anyway, no further abnormality was noted, and the procedure then was concluded. The final diagnosis was prostatic utricle cyst with a stone. The patient has no complication postoperatively and was discharged on postoperative day 2. At 1 month follow-up, hematospermia had completely resolved. No retrograde ejaculation or urinary incontinence was reported. And this case demonstrates that seminal vesiculoscopy is a safe and effective approach for selected patients with refractory hematospermia, especially when associated with utricular pathology. Thank you for your attention.